Welcome to the Cherish training on budget impact analysis. Today, we will be discussing a budget impact analysis, an important economic evaluation tool. Recall that the purpose of an economic evaluation, such as a cost-effectiveness analysis or cost-benefit analysis, is to inform real-world decisions about how best to allocate resources across competing programs or interventions. Although an intervention or medication may be cost-effective, there are additional considerations that must be taken into account regarding real-world implementation, management, and sustainability from a provider or payer's perspective. Budgets are limited. Just because one strategy proves to be a better value than an alternative strategy, i.e., cost-effective or net monetary benefit, does not mean that there is money to pay for it. Whereas CEA and CBA answer questions of relative value, Budget Impact Analysis, or BIA, addresses questions of affordability. Relying solely on standard CEA decision rules can lead to ever-increasing total healthcare budgets. Thus, BIAs are increasingly considered an important complementary tool to CEA. BIAs estimate the expected change in expenditures after the adoption of a new intervention and assists in budget or resource planning. The purpose of a BIA is to estimate the financial consequences of incorporating an intervention to a stakeholder over a given period of time. For example, in addition to the provider's costs of implementing and continually managing the intervention, consideration must be given to how costs and revenues will change after its adoption, which requires accounting for predicted changes in healthcare utilization resulting from differential treatment effectiveness, changes in uptake in the target population, etc. Both CEA and BIA share many of the same methodological requirements and data elements, but there are important differences in how BIA incorporates and analyzes these data given its intended use, such as budget planning. The analytic framework in BIA must take into account the nature of the health condition being targeted by the intervention. First, the target population must be identified and changes to it estimated over a period of time according to the prevalence and incidence rates of disease or disorder, as well as how the interventions will affect these rates. Second, predicted changes in healthcare utilization and other relevant costs are accounted for. In simpler terms, the BIA estimate compares the cost of illness pre-adoption to the expected cost of illness post-adoption over a given period of time. Let's now briefly discuss the key elements we referred to in the prior slides. Budget impact is tailored to inform the financial impact that adopting an intervention will have on a given stakeholder. Therefore, the time frame of interest is generally short, between 1 to 5 years for purposes of budget planning. Recall, the target population consists of all patients who would be eligible for the intervention at any given time point. We must then predict the proportion of the target population who will alter their current treatment as a result of the intervention. For example, if a provider is now able to offer a new extended release formulation of buprenorphine for the treatment of opioid use disorder, how many people in the target population will initiate it? And of those who do, how many switch from a different medication or formulation? And how many were not receiving pharmacotherapy at all? We must also consider how the intervention will affect expected patient or client pool from which the target population is derived. For example, if the provider in the previous example is the only one in the immediate area offering the new extended release formulation of buprenorphine, this could attract new patients. Now, taking the aforementioned changes into account, the provider must estimate the change in total costs and revenues during the time frame of interest. Given the short time frame and budget planning purposes of the BIA, costs and revenues are not typically discounted, nor is expected inflation typically accounted for. However, the computational framework should be constructed in such a way that the decision maker can readily incorporate these factors if they wish to do so. Finally, as with any predictive analysis, sensitivity analyses should be conducted to evaluate the robustness of your findings. On the Cherish website, we have a budget impact Excel tool based on the Clinical Trials Network trial on HIV rapid testing and counseling, CTN 32. We conducted this budget impact assessment at 12 substance use treatment programs in 2009 and demonstrated efficiency, feasibility or acceptability, and cost effectiveness of an on-site rapid HIV testing compared to off-site referral with no additional benefit for on-site pre-test HIV sexual risk reduction counseling. Here is a real-world budget impact example. HCV treatment has been shown to be cost-effective from the healthcare perspective and societal perspective at a willingness to pay of $100,000 per QALY. But just because it is cost-effective does not mean that there is enough money to pay for it. One state Medicaid medical director explained that they understood that the new direct-acting antiviral medications for HCV were a good value, but treating all beneficiaries with hepatitis C would consume the entire state Medicaid budget. For more information on the cost effectiveness and budget impact of HCV treatment, we invite you to check out the HCV issue brief on the Cherish website. In summary, budget impact analysis is a useful tool for planning budgets and forecasting, and it provides estimates of changes in expenditures for a chosen stakeholder. However, unlike the result of a CEA or CBA, a budget impact analysis does not produce a measure of value. As always, the choice of stakeholder perspective and the time frame is critical. For example, for a given perspective, we might find that although intervention A is more effective than B, it is also substantially more expensive than intervention B and raises the payer's cost initially. However, perhaps over a 10-year time span, intervention A may actually save the payer money due to downstream changes in healthcare service utilization. Therefore, the timing of the intervention-related changes and associated costs will affect the likelihood of adoption. For more information on budget impact analysis, please visit the links below. Thank you.